How long do cheekbone implants last? I've heard it's a myth that they don't last a lifetime, which is fine, but how long do they normally last for? Also, I've heard mixed things about whether or not they are screwed on. A plastic surgeon recently told me that they are never screwed on, and this is a myth. Is this true? Thanks.
Thank you for your question. You've submitted a question without a photo. However, the body of your question, you're essentially asking about the longevity of cheek implants, and then further you have done some consultation and a plastic surgeon answered your question about whether or not implants are screwed in, and the plastic surgeon said that they're never screwed in, and that was a myth. So I can understand your confusion, and I can certainly help you understand my approach to the world of cheek augmentation in my practice as it is currently. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. And cheek augmentation as part of facial rejuvenation has been something that I've worked on for my entire career. And everything from placement of cheek implants as well as fat grafting as well as fillers. So I'll tell you how my current approach is, again, to help you understand the thinking and how I've evolved. So to begin with, when you do these types of consultations, you are certainly going to be subject to the biases of the practitioner who is offering you a solution. So, for example, typically speaking, dermatologists don't do surgical cheek implants. So very often, if you only go to a dermatologist, you're going to get offered a lot of different types of filler options. Then when you go to plastic surgeons, even if they do some fillers, they may lean towards doing surgical implants and will naturally give you a perspective on the benefits of surgical implants. And so I'll tell you first from the cosmetic surgeon's perspective as how I evolved from what I was doing prior to what I'm doing now. So a lot of times patients who came who were a little bit older were frustrated that when they were getting fillers placed into their cheeks, the cheek volume became kind of strangely doughy looking and not so well defined. And I explained that at the time that essentially when your skin is loose and the soft tissue is loose, then you can't put that much filler in your face without it sagging. So it became part of my routine that I would put like a cheek implant, but I wouldn't do it in isolation. I would do it with a facelift procedure. So that way the cheek volume was restored at the structural level on the bone structure. Now, that's certainly a good solution, and it certainly worked very well. And as far as to answer the question about whether or not cheek implants can be screwed in, with due respect to the plastic surgeon colleague, yes, it is routine to screw in a cheek implant with a titanium screw. I don't know why that would be perceived as a myth. One of the early approaches to doing cheek implants, and it still is a valid approach, was to use a suture to pass through to the externalize through the skin and tie it over a bolster so that the pocket of the implant would eventually, over the several days, close down, and then you take the stitch out. With titanium screws, you can actually fixate it more predictably, in my opinion, and that way they can be more stable. But one of the things that is very important to understand, and what the longevity question definitely exposes, is although the implant can be in place for many years, your face changes, the bone volume changes, the fat, soft tissue overlying changes. So one thing that has evolved in my practice is when I see someone who has reasonably good skin quality and tone, is that as an alternative to cheek implant placement, we do something called structural volumizing using long-lasting fillers. When I say long-lasting, I'm talking about the thicker fillers that are designed to last longer, such as Juvederm Ultra Plus or Juvederm Voluma. It's really transformed my approach to helping my patients, and as of course I'm a surgeon, so I can do both the injectables and as well as the surgery. But when I look at the practicality and the actual controllability, I have to say that now I'm doing a lot more placement of filler using the technique of structural volumizing. Now this is different from what I was describing earlier. Most doctors, and this is not just dermatologists, but most practitioners, when they place filler, they place it at right below the skin level and try to enhance through molding of the material under the skin to try to create the illusion of certain, like a cheek bone perception or structure. When we do structural volumizing, the technique involves placement at the bone level. And so it really helps correct what is the underlying issue, which is bone loss. With structural volumizing, I'm able to control volume very, very well. I'm able to place at different areas of the cheek in a way that I can customize, and I'm actually able to try to maximize symmetry in a face that is always asymmetric. So, and not to mention that the procedure takes only a few minutes to do, as opposed to doing in the placement of a cheek implant in the operating room. So, with this kind of solution in mind, essentially you can adjust what you do as the patient gets older and deals with all the other factors that can affect cheek volume. People go on different diets. People lose weight for a variety of reasons. And so it can be customized as things change, in addition to normal facial aging. So essentially my thinking would be is that if you wanted to have a solution for the cheek, and not only there, but also you can place the material on the chin, the jawline, the jaw angle, and create the effect of a lot of a facelift, if not one step beyond, again, based on the type of anatomy and age of the patient. There are certainly a lot more opportunity to do these things in a customizable way and do it without going into the operating room. So I think that I would encourage you to pursue more research and meet more doctors and learn about structural volumizing as I described it. I think that you'll find yourself maybe gravitating towards doing the injectables with this technique rather than commit to a facial implant. Again, there's nothing wrong with facial implants, and certainly I'm very proud of the ones that I've done, but I think that now we have a lot more options, and we want to always hear what is right for the patient and try to solve the issue in the most practical, safest, and predictable ways possible. So I hope that was helpful. I wish you the best of luck, and thank you for your question.